So March 7th or whatever it was, we all get told, okay, go home. Everybody's like off campus, right? But it's kind of the multiple layers of this thing that really is the biggest challenge, because it's not one thing.
I mean, every city across the globe has been, I think, transformed by this virus. The impact of COVID-19 has really had a disproportionate impact on not only our small businesses, but people of color, the unhoused, and people that don't have access to healthcare. And it just really highlights the systemic racism and inequities that we have throughout our society, even here in Berkeley.
It's a pretty big racism. I don't think there's any analog for this in the history of the United States.
The downtown Berkeley McDonald's, there was a wave of infections, and it's been hard. I mean, our businesses have, some of them are closed permanently. They will never reopen. Some of them are at reduced capacity. Employees have been laid off or furloughed. Unemployment is at record highs. People are on the verge of losing their housing, even though we have incredibly strong tenant protections in Berkeley, including emergency eviction protections. What happens after COVID?
I haven't been working since I've been here, but my partner was working, and his job, he got furloughed off of his job. And so we don't have that extra income. Luckily, like prior to coming to Cal, I had saved up. So we've been living off of that savings. But it's coming close to being like depleted, like completely depleted. So it's something that we need to address, where he's still looking for jobs right now, especially like just something that'll help us pay the bills, because the rent's still coming. Like, they don't do late fees, but they still charge us rent every month. Right now, none of us here can afford to pay any of our rent.
Unfortunately and tragically, this is a reflection of the housing crisis that we live in. Many of our unhoused residents live in unsanitary outdoor conditions or very cramped indoor conditions in shelters that are the perfect environment for rapid and really dangerous spread of the virus. You hear horror stories of massive outbreaks in shelters in other cities or in nursing homes, similar sorts of congregate living facilities. And so, our staff have worked really hard to decompress our shelters and find additional sort of emergency approaches to get people housed as quickly as possible.
Prior to Cal, prior to anything, like, I had been struggling with a lot of just mental health issues. And when I finally got to Cal, I was able to get the help that I needed. And it was wonderful. But then COVID hit, and I think that everything just got like exponentially harder. Like, it was just bearing down more and more and more.
If I was 21 years old and in the midst of this pandemic and all of the ramifications of it, I don't know what I would do. The idea of people at the beginning of their thinking about a career, having worked their butts off to get into the top public university in the freaking world and being ready to go for the next step. And then what is the next step? And what are the rules now?
I feel like life has been really much more simple. I hate to bring up capitalism, but like what capitalism has created, what reality capitalism has created in my life, which is excess or like a lack of clarity and a lot of confusion.
I never really used to be a gamer that much, but now again, decent amount. Like hardly ever, but no, I was kidding. I get pretty often. Like that's pretty funny. I feel like that's happened with like a lot of my friends back home too. They've done the same thing because there's not much else to do when you're at home other than like watch Netflix, which gets old. Watch TikTok, which like eventually just makes you feel brain dead. Play games. Exercise is fun too. I like that.
Bro, you have not exercised. That's a lie.
Yes, I have.
That's a lie.
Trying to keep things factual, guys.
And I think that COVID paradoxically and it's been like absolutely traumatic in a lot of ways for many people, but it's also forced a paradigm shift.
You're like stuck in a tiny area. I would never want to compare it to like solitary confinement itself, but I think that there is something that happens when you are removed from any kind of socialization, and placed into like a confining area. After all of this started happening, juggling both my schooling, my daughter's schooling, trying to get my mental health in check, it was just too much to bear.
There's a lack of understanding from like faculty or just like professional staff at Berkeley about what students are going through. I think like this is really highlighting the fact that like a lot of students fall through the cracks, and if those cracks are that big, then we need to mend them. You know, like if there are students struggling with basic needs, students struggling with academics because of their lack of like access to different resources that the school has but they're not advertising or promoting or expanding, you know, this is a time to really make those amendments. For RAs, like it almost feels like Res Life really doesn't care about the fact that like of like RA safety and like the rhetoric. I remember from our training when I first started the job this summer was like, yeah, like thank you for being on the front lines of this, but like there's I think like a lack of transparency in how policies work, you know, within Res Life, but also just like within the school itself.
Latinx students are the most impacted by far. You know, you see the data that Latinx Californians are getting infected at 5 times the rates of whites, but it's not until you actually see how people experience that you get how big the inequities of COVID are.
In work, they did cut my hours and they cut my mom's hours as well. But then afterwards, we kind of took advantage of a lot of the food banks that they were offering in my hometown. So it was like, it kind of got better, but definitely like there was this time when like we were really kind of like figuring out, okay, like how are we going to get food in the table? My mom is a field worker. You can't do field work from a computer, right? I was a restaurant worker, and obviously like I'm not going to be, you know, giving food out through a computer. Most of us are considered essential workers. So it was more of like, you need to be really careful because if you get sick, you probably die because most of us cannot even apply to get healthcare. So it was kind of like just a lot of fear and like, you need to be really cautious on how you navigate this whole pandemic. I was only lucky because I'm a Berkeley student and I'm here at the moment. But if I was down in Santa Ana, I feel like it wouldn't be as easy.
I don't want Berkeley to be a microcosm of like selective immunity that's happening in the rest of the country, where like privileged folks with access to wealth, oftentimes white, like get immunity, get rapid testing, have access to healing and treatment. And then folks who are disenfranchised, marginalized, and don't have as much access to power and wealth, like don't.
You know, I think we've done a good job in Berkeley of getting out there early in partnership with other counties to issue our shelter-in-place order. We were one of the first regions to require that people shelter in place, and that really was critical to help control the spread of COVID, and then as well to make decisions based on science and to make decisions that are centered on public health.
I've had students who have to attend class from their cars because they don't have Wi-Fi in their homes. And so they go somewhere in their car with their phone and they jump onto some, you know, public Wi-Fi site and they come to class. And they're sitting in, you know, broiling heat or in some places freezing cold with their car in their car trying to be a student at Cal. I mean, it's nuts.
I'm a re-entry student, so I remember what it was like to be in your like early to mid 20s and think that you're invincible. So when this first started, I remember there were two different demographics. There were the people that were taking it very seriously, sheltering in place, and there were others who didn't take it maybe as seriously, and they would gather together and throw parties.
There were a decent amount of gatherings that I'm aware of. For example, I think someone like posted on our Facebook page on like during graduation when like frats were like throwing events, and then also for the 4th of July, a lot of frats were getting, like doxxed on like Berkeley student pages.
Pointing the finger at Greek life is always easy, but a lot of the issues come with like mixing of different friend groups and like different living situations.
The gatherings, from my knowledge, like have continued. I think at the beginning it was more like covert and like under everyone's radar, but like someone recently told me that they were given a consent talk at a Halloween party, which kind of is indicative of like the fact that that gathering was probably so large that it was like it merited like someone giving a consent talk.
Person who we were exposed to mentioned that he was positive on the day that like I ended up showing symptoms. It was really strange because it was a quick symptom onset at like 8 p.m. one night, just a headache and a lot of fatigue, and then couldn't sleep that night, and then it was gone like the next day by the afternoon. The worst part, like when getting it or knowing like you have symptoms that are starting to creep in, is like the anxiety of not knowing where it could go or like how bad it could get.
I had like the opposite experience. I did everything I could not to get it, and I ended up getting it, of course, indirectly from other people being irresponsible. And me and my roommate, who were being responsible, got so sick, and it's because of other people's negligence. I think that's like the worst part of this, is like having to put your health in like the trust of other people, because people are genuinely selfish.
I think key aspects that we learned worked over the summer were making sure that there was a sort of frictionless, low barrier, no stigma way to get tested if you were worried you had COVID. You don't have to force people into things. You don't have to make it punitive. That if you give students an option to sign up for a system that works for them and they believe is going to be used in their best interests, and their information will be kept confidential, that really students will absolutely partner with you and totally voluntarily participate.
One thing that I really want students to know is how vital it is to have compassion for each other during this time. I think one thing that has really become apparent, especially as we're trying to encourage folks to follow, the behaviors CDC approves for like social distancing and guidelines, is I feel like those guidelines sometimes have created a stark them versus us.
I also think there's been a lot of ethical realizations that people are coming to within the community about just the glaring disparities in general that are prevalent in our society, and how those disparities are kind of shown as like a microcosm in Greek life.
Berkeley is not absent of prejudice. I've been in several meetings where Zoom bombing has happened, specifically using racial slurs against other Black students. And obviously every single time it's hard to listen to and it's hard to experience. And I still don't even have a good answer on how to cope with that and how to navigate that. And so it feels like there's a lack of consistency with how we address situations. There's been so many times when a situation has happened and me and other Black students are getting reached out to when we're the one who needs to regroup and get comfort, rather than trying to organize strategies on how to address the situation. That sounds like a paid position that should be included within the university's budget.
COVID-19 is just an example. What we're seeing with the distribution and who is disproportionately impacted by COVID-19, both in terms of infection rates, morbidity, and mortality. What we're seeing is that Black and Brown communities are more heavily impacted. There are very valid reasons why there's such a high degree of medical and institutional mistrust among the Black community. But in terms of the benefit from taking the vaccine versus the side effects, I would definitely encourage people to get the vaccine when they are able. And then I think you mentioned, there are lots of vulnerable communities where, homeless, those who are homeless, those who are living in congregate facilities, which makes their risk for contracting COVID-19 that much greater. And so I think making sure for those kinds of communities that we're putting measures in place to create as safe an environment as we are able.
I'd say our biggest goal right now is for the least number of people in this city to die as a result of the pandemic as possible. Been lucky to see relatively low numbers in our community. But even if we push through this, we'll be dealing with the social, the cultural, and the economic fallout of these shutdowns for years to come.
Our city feels really empty right now, honestly. It feels like a part of the energy and the spirit of our city is kind of missing. But for those students that are here, it is important to recognize that you are not just students on the Berkeley campus, but you are part of the Berkeley community. You're part of a larger city. Your presence here and the actions, have a direct impact on not just your safety, but the safety of other people in your community.
And I think also holding admin's feet to fire, to be like, you need to act on this, because it's not okay to put it on student leaders to figure out this response. And don't get me wrong, student leaders want to be involved in those conversations actively, but it's not our jobs to solely figure out what the university is going to do. And for me, that's been something that's been sitting with me a lot, especially these past couple weeks, that our student body is so resilient. They come from so many different lived experiences, so many places around the world, and everyone has their own story of how they ended up at Berkeley. So we need to hold on to that resiliency as long as we can in the most uncertain times, and know that we as a community are working together to combat COVID-19.